So, Bismillah ar-Rahman ar-Rahim. Alhamdulillah wa salatu wa salam ala Rasul Kareem. Assalamu alaikum wa rahmatullahi wa barakatuh. You are all welcome to Oasis Muslim Care Foundation's first webinar. Oasis Muslim Care Foundation is an NGO which was founded by the Muslim Student Society in Lawrence Central Branch. Our chairman Oasis, will later on tell us more about Oasis during the course of this program. So our first webinar, which is on cancer causes prevention, and management, which will be handled by Dr. Sharif Aderibigbe. Please mute yourself. So, Dr. Sharif, Dr. Sharif Aderibigbe obtained his first degree from the College of Medicine, Obafemi Awolowo University, Ile-Ife, and completed his residency program at Obafemi Awolowo University Teaching Hospital. He's a product of Great Ife. He is a fellow of the European Board of Surgical Oncology, West African College of Surgeons, and the National Postgraduate Medical College of Nigeria. He also earned a Jan Berman Fellowship in hepatobiliary surgery and liver transplant at the Sanganga Ram Hospital, India, in 2017, and the International Surgical Oncology Fellowship at the Memorial Sloan Kettering Cancer Center in 2021-2022. His clinical interests cut across surgical, gastroenterological oncology, and hepatopancreatolobiliary surgery / liver transplant. I had to practice several times to pronounce that properly. I hope I got it. And he is an active member of the African Research Group in Oncology. He is a consultant general surgeon and surgical oncologist, and currently serves as the head of surgery, clinical lead at Iwosan, Lagoon Hospital. So join me in welcoming Dr. Sharif Aderibigbe. Without further ado, please, Dr. Sharif, you have the floor.
Okay, so I'll try to share my screen here. If I can't, I think you. Okay. I think you disabled participant screen sharing. Hello?
Okay, let me enable that. Let me enable that.
Okay.
Or better still, let me just download your paper and then share screen. I'll enable that later so that then you can continue, so as not to waste time. While we're waiting to get the screen, slides loaded, we'll be taking questions, but we'll prefer that your questions are sent in chat. We'll take questions that are sent in chat first, before we then take questions from the audience, if there is still time. We hope to finish this in just 80 minutes. We hope to end this program by 10 minutes to 6 Nigerian time. So can you see my screen now?
No. Not yet.
Okay. Just a minute. Okay.
Okay.
Okay. Can you see the screen now?
Yes, we can.
Yeah, please go ahead.
I think you can make it the full screen so that I think you can make it a full screen so that it won't be showing other things here.
Okay.
That's not yet done.
How it's been done here? Oh, okay. All right.
Not yet done though. I mean, slideshow. Make it a slideshow so that it should be.
Yeah, it's a slideshow now.
No, I'm not seeing. That's not how it's showing it. Oh, whichever. So I will Assalamu alaikum warahmatullahi wabarakatuh. Everybody, and welcome to the webinar. Here, I'm going to try to make it as understandable to the layperson or the person that is not specialized in the medical field as much as possible. So, pardon my attempts to do that sometimes, because sometimes some things need to be explained a little. So sometimes I'll try to be fast so that I can encapsulate everything, because it's always here for us to. We can always. It's going to be available for us to like watch again. So inshallah, I'll be talking this evening on cancer causes, management, and of course I'll end with prevention. So next slide. Next slide.
Okay.
Next slide. Because if everybody is not seeing the next,
that's introduction.
The next slide is cancer introduction. It's the next slide, but it's not showing on the screen.
Okay, just a
so
minute.
That everybody will be able to follow. Yeah.
I think I know.
Okay. And this your sucker to the humor is blocking some of the writing. I don't know whether it's showing in other people's.
Yes, it is.
Can you click enable editing?
Sorry, just
I think the best is still to try to enable screen sharing so that I can do it myself. Yeah. Okay, good.
Okay.
So
we're fine now.
Yeah, good. Yes. Cancer as the literally is gotten from, I think it's Latin or Greek one. I'm not sure which one it's. Cancer, it means like a crab. So it's a good description because that's often how it looks on imaging when you see it on imaging. Because usually as poorly defined border, that's one of the things you look at. No cancers on image. Usually as poorly defined borders. So you find it like a stellate appearance. So cancer generally is an uncontrolled growth of abnormal cells anywhere in the body. I underline those three: uncontrolled, abnormal, and anywhere in the body. Because the growth is, now the body normally grows, isn't it? However, when the growth is uncontrolled, the cells are abnormal, then that is what usually defines something as a cancer. Now, there can be a controlled growth of abnormal cells, maybe like inflammatory cells or something like that. That doesn't define them as cancer. There can be uncontrolled growth of normal cells. For instance, that's usually like a benign tumor. Is like when you look at each individual cell, they look normal, they act normal, but it's just uncontrolled. So that you now form a swelling somewhere, but it's a benign tumor. That's not a cancer. I know when we say anywhere, anywhere, it can happen everywhere in the body that has blood vessel that is supplied by blood. However, ear and the nails, I'm not talking about the nail bed now. I'm not talking about the nail bed from where the nail grows. Ear and nails that have grown out are actually They are just made up of keratin. So there's really, cancers can't happen to them. So anywhere else in the body, from the top to the toe, cancers can occur. So it's uncontrolled growth of abnormal cells anywhere in the body. Usually, people, it's synonymous with malignancies. Now, as I said, most cancers form tumors. Tumors just means a swelling somewhere. So most cancers form tumors. However, not all tumors are cancers. You can have tumors that are just abnormal growths, like they call them benign tumors. They call them benign tumors. That means they are uncontrolled, but they are normal cells. So, but not all tumors are cancers, as I said. So you can have solid tumors versus leukemias and lymphomas. Usually, solid tumors are those that you can feel that you have a swelling there. Either you can see it outside or it goes inside. It's a solid tumor. Or you can have, I don't want to call them liquid tumors, or you can have tumors of the bone marrow or blood. That's where you have leukemia. When they say he has blood cancer, you can't really see it as a swelling usually in the blood. And it shows as other features. So the primary characteristics are that they are uncontrolled and can metastasize. Now, this ability to metastasize defines cancers generally, broad strokes. So metastasis means something is going somewhere and it gets to another part of the body that is not directly linked to it. Usually tumors, cancers can go either through the blood or the lymphatics. The lymphatics they are like channels in the body that drain fluid so that our bodies are not swollen. They drain fluid away from other parts of the body and drain the fluid back into the blood. Yeah, so those are lymphatic. So these tumors can metastasize. I mean, go from their primary place of origin and escape to other places in the body through either the lymphatics or the blood vessels. Next slide. Next slide. Yeah. So now cancer, I'm talking about the epidemiology now. Now, it's actually not as uncommon as we think. Actually, it's the second single highest cause of death in the whole world. You see, we say 33% of people die from cardiovascular illnesses, stroke, heart attacks, things like that, other cardiovascular diseases. 33% of people that die in the whole world die from that. While 18% of people, 1/5 of all deaths are actually from cancers. Now that's the whole world. In some other places, the proportions may differ. So now, as I'll show you now in the next slide, the death rates are different in different parts of the body. Now, I said in the body of the world. So death rates are usually worse in developing countries for many different reasons. I think the primary reasons are that the people present later in this part of the world and the treatment is not as good. So a combination of those two are fatal factors that make people actually die a lot from cancer in the developing countries. That's why it has even a worse, although the perception is bad everywhere. I have cancer, it's a big thing, people. However, the perception is deservedly worse here because much more people die. However, the rates of dying from cancer is dropping in the more developed countries. Not that the rates of incidence is dropping, but the rates at which people die from it is what is dropping. The rates are still increasing for many different reasons. And some of the reasons are, okay, let's go to the next slide. Next slide. Yes, I just put these two pictures so that we can have an idea of what I talked about just in the previous slide about the death rates differing from different parts of the world. If we see, if you look at Asia, of course, they are the plentiest in the world now. So they have the burden